What is chemotherapy-induced neutropenia? Neutropenia is a condition characterized by abnormally low blood levels of infection-fighting neutrophils, a specific kind of white blood cell. Neutropenia increases your risk of bacterial and fungal infections. Chemotherapy and neutrophils. The timing of the drop in neutrophil levels is based on the type or dose of chemotherapy. Neutrophil counts generally start to drop about a week after each round of chemotherapy begins. Neutrophil levels reach a low point about 7 to 14 days after treatment. This is called the nadir. At this point, you are most likely to develop an infection. Your neutrophil count then starts to rise again. This is because your bone marrow restarts normal production of neutrophils. But it may take 3 to 4 weeks to reach a normal level again. When your neutrophil level returns to normal, you are ready for the next round of chemotherapy. Signs and symptoms of neutropenia. Neutropenia itself may not cause any symptoms. For people with neutropenia, even a minor infection can quickly become serious. Talk with your healthcare team right away if you have any of these signs of infection. 1. A fever, which is a temperature of 100.5 degrees Fahrenheit, 38 degrees Celsius, or higher. 2. Sore throat, sores in the mouth, or a toothache. 3. Abdominal pain. 4. Diarrhea or sores around the anus. 5. A cough or shortness of breath and other non-specific symptoms. Why does neutropenia occurs? The most common reason that cancer patients experience neutropenia is as a side effect of chemotherapy. Chemotherapy involves the use of drugs to destroy cancer cells. Chemotherapy works by destroying cells that grow rapidly, a characteristic of cancer cells. Unfortunately, chemotherapy also affects normal cells that grow rapidly, such as blood cells in the bone marrow, cells in the hair follicles, or cells in the mouth and intestines. Why is chemotherapy-induced neutropenia important? Chemotherapy-induced neutropenia is important because it may 1. Increase your risk of life-threatening infection. 2. Disrupt delivery of your cancer treatment, resulting in a change to the planned dose and time. Who is at a higher risk for chemotherapy-induced neutropenia? 1. Patients receiving chemotherapy that decreases the number of white blood cells. 2. Patients who already have a low white blood cell count, or who have previously received chemotherapy or radiation treatment. 3. Patients aged 70 and older who may be at risk of more severe infection and longer hospitalizations. 4. Patients with other conditions affecting their immune system. Can neutropenia be prevented? Chemotherapy-induced neutropenia can be prevented in most patients with the use of white blood cell growth factors. Blood cell growth factors are naturally occurring substances called cytokines that regulate certain critical functions in the body. They are responsible for stimulating cells in the bone marrow to produce more blood cells. The white blood cell growth factors approved by the U.S. Food and Drug Administration for the prevention of chemotherapy-induced neutropenia are Neupogen, filgrastim, and Neulasta, pegfilgrastim, and lenograstim. Chemotherapy-related infections may 1. Delay chemotherapy treatment. 2. Require changing the patient's chemotherapy dose. 3. Require hospitalization, most commonly in the first and second chemotherapy cycles. Thanks for your kind watching. Please like, share and subscribe my channel for next helpful updates.